Hi, I'm Gary White for Channel 6, Central Kentucky Television, and I'm talking with Dr. Trish Ciccone with Central Kentucky Optometric Associates via Zoom. We're practicing our social distancing because we're well more than 6 feet apart.
More like 6 miles.
Exactly. But we wanted to check in and see how the current situation is affecting Central Kentucky Optometric Associates and let your patients know that you're still open for business, right?
We, even though we're crippled, we're still open for business. The first thing I want to say is that all our staff is healthy right now, and we're very thankful for that. Well, on about March 15th or 16th, we got a request from the CDC to just pretty much stop doing business. And then they clarified what they wanted us to do. And the clarification was they want us to cease doing all routine vision care, but they want us to remain open for emergencies and urgent situations because they don't really want people with eye injuries and acute eye and vision problems going to the hospital and the emergency rooms, which that hasn't changed our practice much at all because we've always recommended that folks do that with their eye and their vision emergencies anyhow. So, we don't have to change anything that we do to be able to see these folks. We don't have to change the way we practice. So we're able to see those folks and take care of their emergencies quite readily. We then got about 2 days later, got a message from the governor and from the Kentucky Board of Optometric. And they pretty much indicated that they supported the recommendation from the CDC and that they were asking us to cease pretty much immediately, cold turkey, just stop seeing routine eye care. And as you can imagine, that's pretty tough. We just cold turkey in the middle of operations. Mind you, we had already been, watching the news and taking precautions ourselves and our patients, trying to make sure that we were safe and not transmitting the virus. And so we hadn't taken quite a few precautions, but it was shocking to just have to close down like that. We had patients having surgery. We had patients with emergent problems, and we have patients that have been waiting, a month or more for their routine eye care, and now all of a sudden we can't see anybody. We have a staff to pay, and our staff, they're all of a sudden their future is uncertain. So it has been a crisis, to put it mildly. But we just kind of hunkered down and are trying to get everybody that needs to be taken care of on an emergent situation. We have our staff situated and their finances and all of that is secure. So they're more comfortable with this situation now. We have kind of limited our hours right now. We've kind of weaned it down, and we're going to be open from 10 in the morning till 1 in the afternoon with staffing in here. But we only have one doctor and one staff member here at a time. The doors are locked. We are social distancing to the extreme in here. So you can get a hold of us, as you've seen my phone rings off the hook. You can get a hold of us. You can pick things up, take things off. If your glasses are broken, you can drop them off and we can fix them. We have been allowed to extend some contact lens prescriptions out 3 to 6 months. So that folks who are out of contact lenses and need to reorder, we can do that. We've arranged for direct shipping for those, so that you don't have to even come in to get them. All you have to do is let us know, pay by credit card, and then we'll have them sent directly to you. We're using Zoom, we're using FaceTime, we're using an application called Doxy.me. We're using all those, Skype, we can Skype. So we're using all of those applications to try and do some telehealth visits, and we have done a few of those. Some things with an eye exam, or some things we can handle pretty well with a telehealth visit. Other things we just can't do, unless you're in the office. So We have so far about 2.5. I think we're working on our 3rd week of rescheduling patients. We're not removing people from the schedule. We're just kind of striking everybody out, trying to call ahead of time through those visits that need to be done. If you're a post-operative person or if it's an acute problem that we're following up with. If we can't follow up by phone or with a telehealth visit, then we might recommend that you come in. When you do come in, it's going to be a lot different in here because we're only allowing one patient in the office at a time, and that helps the staff. The staff will not come in direct contact with you. The only person that will come in direct contact with you is the doctor. We're going to be gloved and masked up, and we're going to ask you to glove and mask up also. We're going to, take care of business, and the rooms are all disinfected before you come in, and they're all disinfected again after you leave. So we're just not going to have more than one patient in here at a time, and that's just the way it has to be for now.
Right. And there has not been any talk of a time frame as to when normal.
No, we are in the kind of in the dark as much as everybody, and it all depends on how we flatten this curve and how we keep our cases down, and how it's all really at this point, if there's no treatment for the virus and there's no vaccine for the virus, then the only way we can mitigate the virus is by changing our behaviors. And so, be prepared. Even when we do open back up, we're not going to be able to run on a full schedule because we're going to have to probably continue to social distance and mitigate. It's a problem. PPE is a problem. Even before this happened, I just kind of had an inkling that something was, amiss. So I did order some safety goggles and some masks, and we didn't even for a while think we were going to get them. We thought they had been diverted, and we kind of think maybe they were, and then they refilled our order. So we have a supply of masks that we can use. They're not the N95 masks, they're just surgical masks. So we have to be careful there. You're going to be asked some questions when you come in. And if you're actively in an infective process, we're not going to be able to see you. We're going to have to refer you to UK or U of L because they have the more proper equipment for seeing someone who's actively infected. We kind of have to assume that everybody's has an infection and are approaching it that way. And again, everybody should assume that we're infected too. And if we address it that way, then I think that we can, be relatively safe. There's no guarantees. We all have to go out and get groceries, and we could pick this up in the grocery store, any other essential activity that we have to do. So as much as we will take every precaution that we can to ensure that there will be no transmission from this office, we just can't guarantee that 100%. And I don't think anybody can anywhere at this point in time.
Now, they are saying that in addition to the mouth and nose, different ways of getting this, that it's potential that you could transmit through the eyes as well.
Through the eyes. And that's kind of debatable. Definitely, eyes, nose, mouth, any mucous membrane seems to be able to be a mode of transmission. Now, there was a study that they did recently, and it indicated that it was not readily found in the tears. So that's a little comforting for us because we're exposed to tears all day, every day. They did find 1 or 2 patients in that study that maybe it might have been to a low degree. So I would say yes. Wear eye protection, and we will definitely wear it, and we'll wear gloves, and we'll use swabs when we need to, so that we don't have to come in direct contact. And we'll change the way we do things to minimize and to mitigate transmission for sure. We'll constantly update ourselves on the CDC guidelines and make sure that we're being as safe as we possibly can. So contact lens wearers, that's a big question. A lot of people ask, should I wear my contact lenses during this time? One, if you're wearing your contact lenses, you may not have, you're not going to have a pair of glasses on. Maybe you might wear a pair of safety glasses or a safety shield, but you're less likely to have a pair of glasses on that could protect you from a spray or a splatter or a droplet, you know. So your glasses just give you a little bit more natural protection than wearing contact lenses would from exposure through your conjunctiva. Your contact lenses themselves aren't going to cause transmission, but you better make sure that you're disinfecting your lenses good in case your lenses are exposed through a splatter or a droplet, or that you are really washing your hands 20 seconds, antimicrobial soap. And I always use the soap before I handle my contact lenses and touch my conjunctiva. If you spray your hands with an alcohol-based hand sanitizer and then touch your contact lens, it's going to send you through the roof because it's going to sting like crazy. That alcohol will sting if you touch your eye with that alcohol on. But make sure you're disinfecting your lenses. I think a normal disinfectant should kill the virus, and make sure that you are really disinfecting your hands with antibacterial and antimicrobial soap before you touch your contacts or touch your eye. And then it's probably safe to wear your lenses. But if you're in any situation, if you're out and you're social distance and you're not at risk for getting anybody's droplets or transmission, or you're not going to touch a surface and then touch your eyes, wearing your contact lenses themselves is probably safe. And I'm still wearing mine quite a bit. I'm probably wearing my glasses a little more than I normally wear them. But I am wearing my contact lenses some. And if you're in any situation where you might, be exposed, then put a face shield, something to block the shield, or a pair of goggles, a pair of safety goggles, something over your eyes to protect yourself from transmission through that mode.
Absolutely, absolutely. But as you said, Central Kentucky Optometric Associates is open with less hours, but still open for business. Give a call if they have any questions, and you're trying to reschedule if they did have an appointment that was coming up, you're saying, right?
Yes. Let me give you our emergency hours. Our office hours, Lebanon is 270-692-1871. Springfield hours are 859-336-9388. The Saccone emergency hour is 859-336-5118, and the Dr. Taylor's emergency hour, it's 859-336-9146. And you can just Google us and get on our website, and there's a red cross up in the right-hand corner. You click on that cross, and it's got our emergency numbers on there for you.
Great. So that's a way for everybody to keep in touch. And if you have questions, be sure to give a call. But just maintain good eye health during this period, and hopefully in the near future, we'll be able to get back into your office.
Yes, and we just really want to wish everybody a happy Easter, a happy Holy Week, and just really, try and enjoy this time with your families. This is time that, John and I are finding things, and we're enjoying our boys. Just really stay home if you can stay home. Don't take unnecessary risks at this time. We'll get through this. Just like our governor says, we will get through this together. We just have to all hunker down and be patient and be thankful that those of us that are healthy, and help those that we can. And if you can find somebody to adopt that maybe can't go out to a grocery store or whatever, and make sure they've got everything they need, and that's a good thing. A neighbor or somebody from your church, or anybody that you know. If you need us, give us a call, and we'll make arrangements to get you taken care of.
Sounds good. Thank you very much.
All righty.
Gary White, Channel 6 Central Kentucky Television.